Welcome, friends, to the latest installment of the Top Surgery Recovery video series. We are doing today scar massage. So, before we get into the practicalities of what to do when, I want to talk a little bit about the purpose of scars. So, the scarring is a body's response to an injury, and its purpose is to close up the wound as quickly and securely as possible. And in doing so, it lays down the fibers that make up the scar in a really cross-hatched way that doesn't have a lot of order to it, isn't nice and neat, but is very fast. And in the first few phases of the scar healing process, it's a lot like the early months of a breakup, right? The temptation after a breakup is sometimes like, I really miss them. I just want to talk to them. We can still be friends. But then, every time you try and talk to them, it just hurts more. And similarly with a scar healing, you don't want to get back in there and open it up right away. You want to just give it time, let it do its thing, and kind of be with it in stillness and compassion as much as possible. So, even as soon as right after surgery, you can lay your hands super gently on your chest or hover them right over if touch feels too much, and just try and really coddle it and not do any big stretches. Don't worry, you'll be able to do them again soon. Just let the body do its thing. And then, maybe later down the line, you and your ex can exchange a few friendly texts. You're not ready to meet up for coffee yet, but you can like each other's Instagram posts and it's not that big a deal, right? And so this is the phase of recovery where we can start to actually interact with our scars a little bit. Everyone's healing timeline is going to be different. For me, the period where I was able to start interacting with my scars was, I'm gonna say 3 weeks. And the way I knew that it was okay to start doing that was that my stitches had all come out. I didn't have any scabbing, anything that looked like still open wound. It was like the skin was completely healed over. And at that point, I started using healing balm. This is just what my herbalist gave me. It's olive oil and beeswax based with calendula and ginger and lavender. Any kind of balm or salve or just plain coconut oil, anything your doctor recommends, just whatever feels right for you. You can just take a little bit and gently go in the direction of the scar. Especially early on, you're going to want to be so gentle. You're going to want to go pretty slowly. You want to always go in one direction. You can change it up from day by day, but you don't want to be going back and forth and back and forth. Not yet. This is just about keeping the area moisturized and letting the body know that it's okay, and helping any fibers that are still settling to grow in alignment with each other. And as we're talking about this and really looking at the skin and everything, it's important to remember that the scarring isn't just at the skin level. It goes as deep as the incision does. So once you've gone maybe 5 or 6 weeks and the scars are feeling really pretty healed but still tender, you can start doing small circular motions. And this is breaking up the scar tissue a little bit. It's bringing blood into the area. It's helping the fibers align with each other. And then as you go even further, I would say this is around 3 months, you can start to bring some vibration or what's called in massage therapy circles cross fiber friction. So whereas in the beginning we were going along the scar, this is going back and forth across the scar. And I'm pressing down a little bit, but I'm not going like, it's still kind of gentle. And this is helping to break up any clumps, any knots in the scar, and you know, as I go over here, we have to like go sideways to the scar. Other things that you can do is maybe take your whole hand and massage the whole area. So this is getting into the underneath scarring. It's bringing blood flow into the whole area beneath. And it can feel kind of nice. So now we're going to talk about the kinds of self-massage you can do after 6 months of scar healing. I'm not there yet, so Asher is going to demonstrate. These types of massage are called myofascial release because we are working with the connective tissue rather than the muscles. So the first one we're going to show can be done anytime at 4 months or onward, and it's called side shearing. So what Asher's going to do is take one hand, give themselves a hug, and kind of grab the skin at the back, not grab, like just press down with the palm of the hand and bring the skin on the back towards the front, like around the ribs. And then they're going to gently raise that arm, and then taking a deep breath through the side, maybe pull down a little on the hand, and feel a nice stretch around the lats and the shoulder blade, and then release. So this next one is about opening the chest, and you'll notice Asher's hand isn't right on their scar, it's slightly above, and the palm starts resting on the sternum. And they let their hand go soft and kind of melt into the chest, and then begin to slowly move towards the shoulder. And the idea here is we want to use the skin, which is part of the connective tissue, to pull on those deeper layers of fascia that may have gotten shortened and restrained during the healing process. So once you reach the shoulder, you can kind of brush it off down the arm, maybe shake out your arms a little bit. Yeah, and then do it again on the other side. Bonus level is once you feel comfortable with what your hand is doing, you can roll that shoulder up, back, and down. Really noticing how any releases in those big muscles of the chest might make room for the small muscles in the shoulder to be more comfy. Okay, now we're going to work on the scars themselves. And for this, you don't want to have any lotion, oil, or balm. You want dry skin so that you can grip the fascia. So Asher's going to make their hand into kind of a tool and then start below the scar and then push up so you can see the scar move. And there, maybe push and go as far as it will go. Hold 1, 2, 3, and then release. And you can do that all along the length of the scar. You can do that just in places where it feels kind of tight and restricted. And this is about removing releasing the scar tissue from the layers of body underneath. You can also do this starting above the scar and pushing down. Yep, just like that. And advanced level, you can do it with both hands, one on either side, but a little bit staggered, pushing down like that. Excellent. You always want to be pushing towards the scar, never away. This final technique is only safe to be done after 6 months or more of healing. It can be done at any point, even years after surgery. It's best for small areas of the scar, particularly ones that are bumpy, thick, or particularly restrictive. So what you can do is go to the scar and pinch a length of it gently between 2 fingers, and then roll that part that you've picked up back and forth between the fingers, and then release it back down. Perfect. And you want to do this gently and carefully, keeping in mind that there's going to be some numbness around the scar, so keep an eye out for other signs of overdoing it and just err on the side of gentleness. And definitely don't do this before 6 months.